So, who am I? 3rd August 2024. The first clue is this, that I'm an autoimmune disorder which typically more commonly affects females, particularly elderly females around 60s. Clue number 2, I could also be associated with thyroid disorders, thyroid autoimmune disorder, associated with like Graves' disease or Hashimoto thyroiditis, and also with Addison disease. Clue number 3, I usually present with thinning of the gastric lining and intestinal metaplasia of the gastric wall, and also chronic active gastritis. Clue number 4, for these reasons, I am also associated with increased risk of development of gastric cancer, gastric carcinoma. Clue number 5, I am characterized by presence of an autoantibody directed against the intrinsic factor and also autoantibodies against the parietal cells. So who am I? Obviously, I think it's very, very clear now after the clue number 3, 4, 5 that this is pernicious anemia. So what is pernicious anemia actually? Pernicious anemia is an autoimmune disorder where, like any other autoimmune disorder, body's immune system mistakenly targets one of its body tissues. In this case, they target intrinsic factor and also the gastric parietal cells. So the autoantibody against the parietal cells, the lining of the stomach, and also more specifically, autoantibodies are seen against the intrinsic factor which is released by the stomach parietal cells. So what could be the outcome? Very logically, if your gastric parietal cells would be destroyed, there would be achlorhydria, there would be no HCl secretion, because this patient also suffers from achlorhydria, because that HCl gets synthesized from the gastric parietal cells. And particularly in this disorder, we also get autoantibodies which inhibit the binding of intrinsic factor with the vitamin B12. Now, if the vitamin B12 cannot bind with the intrinsic factor, what will be the outcome? That the complex vitamin B12 and intrinsic factor, this complex is necessary for the proper absorption of the vitamin B12 in the last part of the small intestine, which is ileum. Now, if vitamin B12 cannot bind with intrinsic factor because there is an autoantibody which is targeting the intrinsic factor, the net outcome would be development of vitamin B12 deficiency associated megaloblastic anemia. So it's basically a pernicious anemia is an anemia due to malabsorption of the vitamin B12 deficiency due to autoantibody targeting the intrinsic factor and also parietal cells of the stomach. So this is one part, that there is a lack of vitamin B12 which is resulting in anemia, particularly megaloblastic anemia. And also there could be some vitamin B12 deficiency associated neurological feature, because vitamin B12 is a very much crucial for myelin synthesis. On the other side, another story is happening in the stomach wall also, because these autoantibodies are targeting the stomach wall, particularly the parietal cells. What would happen? There would be progressive loss of glandular structure, including the parietal cell, in the stomach lining. So stomach lining would become thinned out, and there will be development due to loss of glandular structure. There will be development of chronic atrophic gastritis, including intestinal metaplasia. So these changes ultimately would make that stomach vulnerable for cancer development, these changes. So that's why pernicious anemia is also act as a risk factor for gastric adenocarcinoma development, gastric carcinoma development. So the word pernicious actually means very bad. It's a lethal, dangerous one. Like, I hope you have heard the term pernicious. Malaria sometimes was used in the old literature to describe severe form of falciparum malarias. So the pernicious anemia means that it's a deadly form of anemia, you understand? That's the basic idea in this. And as a result of pernicious anemia, what would happen that you develop a deficiency of vitamin B12, and also it could make you prone for change, chronic atrophic gastritis, and also make you prone for the development of the stomach cancer. So these are the things that you need to keep in mind. And the treatment wise, actually, for vitamin B12 deficiency, you need a lifelong treatment in these patients actually. And also these patients need to be monitored for risk of development because of the gastric carcinoma also. So that's all in this session of Who Am I? We learned some basic facts about the pernicious anemia, which is a vitamin B12 deficiency associated anemia, which is caused due to autoantibodies targeting parietal cells and also the intrinsic factor against the, which is released by the parietal cell. Okay, I missed one thing actually, that autoantibodies can be, two types of autoantibodies would be seen in this disorder. One is autoantibodies targeting parietal cells and autoantibodies targeting intrinsic factor. Now, autoantibodies targeting parietal cell is not very specific for this condition because it can be seen in other conditions also. But autoantibodies targeting or against the intrinsic factor, this is more specific, more characteristic for the pernicious anemia. This is another point that you can keep in mind. Okay, thank you so much.